You're watching KSLA News Club now at 4. Today we are keeping you health aware about Parkinson's disease. Now, according to Parkinson's.org, the early onset of Parkinson's disease happens in people younger than 50. Now, April is Parkinson's Awareness Month, and it's your chance to get educated on the disease and the symptoms. So joining us today to talk about the condition, we have Dr. Peiman Zhu, a neurologist with Christus Shreveport-Bossier, and licensed practical nurse Frida Lum. So thank you for joining us today.
Thank you. Thank you for allowing us to be here.
Let's talk a little bit about what Parkinson's disease is.
So Parkinson's disease is a neurodegenerative disease, and it's a second common neurodegenerative disease in following Alzheimer's dementia. So it affects people's movement.
So we've seen a lot of that. I think everybody kind of has followed along with Michael J. Fox and his story and his diagnosis. But some of the symptoms, let's talk about the cause that we're seeing that caused some of those symptoms and how to recognize it.
So the cause is at the cellular level, it is caused by a loss of dopaminergic neurons in an area called substantia nigra. So this is a very small area in the brain sending fibers to an area called a striatum, and then striatum send all the fibers to neocortex. So when these dopaminergic neurons are affected, then a person's ability to have a good coordination in movement will be much affected.
Now, Frida, what are some of the early symptoms that a patient may come in and say something doesn't seem quite right?
Tremors, having some problems with memory, gait problems, walking, balance, changes in their mental abilities to remember things, and it's really
Many different things.
yeah,
that can be
so many
diagnosed.
different things. Yeah.
And as the disease progresses, you see more so the loss of the interdependent ability to move and have muscle control, right, doctor?
Right. So usually the first presenting symptom is bradykinesia, so-called slowing down. So the person will be very slow. Maybe when they present to our clinic, they may be slowing for several months or even a few years.
Gotcha. And then as the disease progresses and you're trying to find treatments, what treatment options are available right now?
We have a medicine called levodopa, and the brand name is Cinemet. So this medicine will help in a dopaminergic neurons to make movement easier.
Making the movement easier. And then in addition to that medication, what are some lifestyle changes that people can try to incorporate if they've received a Parkinson's diagnosis?
So motor symptom is one of the prominent symptom of Parkinson's disease. There are also non-motor symptoms. So we also need to treat those, including sleep problem and GI problem, typically constipation. So we'll help patients improve their sleep quality and generally other aspects of their daily life.
Okay, so if somebody has an inkling that something may be going wrong, they need to reach out to a doctor, follow up with their primary care physician, and see if they can get some answers.
Yes.
All right, well, thank you so much for joining us today and for educating us on Parkinson's as we learn more for Parkinson's Awareness Month.
Yeah.
Thank you.
Thank you for